Yeah.
Hello, welcome, and thank you so much for joining us today for this, if you're here live or on the recording, for episode 9 of Dr. Jeff Talks About Sex and Intimacy. Lubricants for better sex. I can't express to you how much it means to me that you have taken the time to join us and to learn more about this topic. We are on social media, just so you know. You can find us on your favorite social media, Facebook, YouTube, X, whatever you like. We do need 100 followers on Facebook. So if you are a Facebook person, we would so appreciate if you could become one of our followers, because then we will stream live on Facebook as we do that. So we need 100 followers. You can also go to our website to learn more about upcoming episodes. We have so many amazing guests coming on, and I am so excited to share them with you. You can watch our past episodes. And don't forget, if you're in the car, you can listen to us on Spotify. Your favorite music podcast, you can listen to us there too. We are where you are. And so, however you want to find us, I hope you do. I want to remind you that, and this is very important, all are welcome. Whatever your sexual orientation, your gender identity, or your relationship style, you are most welcome here in this space to learn. You know, I have had the honor and privilege of working with so many amazing patients over the last 30 years, both in the private sector at Northwestern and North Shore Endeavor Health, and at the VA with the most amazing vets, our American heroes. My patients are heroes. They share their most personal experiences with me. Can you imagine the most personal things in their lives so we can work together towards health and healing in their lives? I'm not alone when I say that these days, many of us feel bombarded with messages that divide us rather than remind us of our deep, intricate connection to one another and to the world around us. Throughout our lives, I don't know about you, but most of us, we've all experienced moments that made us feel like we're not enough, or that we're somehow less than. So we end up chasing after significance. I want to be significant. I want to matter. I want my life to matter. Hustling, even though it is true that we are inherently enough. These experiences often shape us, but they don't define us. You may have heard of movements centered around kindness, and I truly believe that what the world needs now is more love, more understanding, and compassion. That's why this year, I've made it my mission to cultivate more love and kindness in the world around me. Love and kindness, I don't know if you've heard that term, but it's a practice of being compassionate and open-hearted, not just towards those we care about. That's pretty easy, right? To be compassionate and open-hearted and loving towards those we care about, but also towards those that we may care about but don't agree with, or we may care about but feel quick to judge. That's where loving kindness comes into play. But just as importantly, loving kindness means extending that same compassion to ourselves. Often, the hardest person to show love and grace to is the one that looks back at us from the mirror. So this podcast, it's here to empower you with the knowledge and the tools to improve your sexual health and deepen your loving relationships. All through evidence-based, through the science. We're here to share accurate information with you. And it's all about love, intimacy, and connection, because those are essential to to a thriving, fulfilling life. A few weeks ago, if you recall, or you can go back and see, we had an awesome episode with Dr. Amy Hall on vaginal dryness and hot flashes. So tonight, guess what? We're going to dive deeper into the world of lubricants and moisturizers. I am so excited about our guest this evening. My colleague, Dr. Ann Katz, is a certified sexuality counselor. She is a clinical nurse specialist in Winnipeg, Canada. She's made it literally her mission to provide information, education, and counseling to people with cancer and their partners about sex and intimacy. She is an award-winning, and I mean she's won several awards for her books, prolific author. She has more than a dozen books, and they are excellent, excellent resources. Her work, I will tell you, I truly believe I have read her work. I was part of the group that looked at giving out awards that awarded her for one of her books, and she has done transformative work for men and women with cancer. Talk about somebody whose life has made a difference. That is my guest tonight, Dr. Ann Katz, and we are so excited that you are here to share your expertise with us this evening.
Thank you so much. I'm barely fitting into this room because now my head is so large. So I always find these intros sort of rather embarrassing, but I'm grateful. And so thank you. Yours has been one of the best.
Well, it's what I said is absolutely the truth. You have done wonderful work, and your books on cancer, women with cancer, and for men with cancer, in terms of sexuality and intimacy, because people get so caught up in the cancer, we forget about the importance of relationship, intimacy, and how vital it is when you're going through cancer and after cancer treatment. So I think your work is really transformative, and I'm so glad you're here to talk to us tonight about lubricants and moisturizers.
Okay, so let's go.
Let's do it.
And I really hope that people have questions, and we can talk about that at the end of my rather brief talk, because Dr. Jeff told me it has to be kind of brief. So here we go. So, this is a topic that is near to and dear to my heart, because I see so many, particularly women, with vaginal and vulvar dryness. And I just want to really stress that it's not just the vagina, even though everyone sort of talks about women's genitalia as the vagina. It has many different parts, and you'll see just in a second that the different parts actually are different in their structure, and to a certain extent in their function. So here we go. I'm going to be talking a lot about products, but I really, if I had even $1 for every time I talked about a specific product, I'd have a fair number of dollars, but I'm not affiliated with any company, so no conflicts at all. So one of the most important things that I find in my clinical practice is that people really have little to no understanding about the difference between lubricants and moisturizers. And when they use a product for the wrong reason, it doesn't work, or at best, or it actually causes harm. And they often will give up on trying to find a product that works for them. So I'm going to talk about what, when you use moisturizers, when you lose lubricants, this talk is specifically aimed at women and the men and women who love them. So, this is not just for women, but a lot of this comes from my work with women with cancer and their partners. So, you'll see a lot of mention of that. So this is a very busy slide. I apologize, and you really don't have to memorize this because there is no quiz afterwards. But the tissues down there, and often when I see patients, and I'm a nurse by background, so I have patients, not clients. They'll say to me, well, I'm dry down there, or it hurts down there. And I tend to sort of keep it a little bit lighthearted and say, you know what, down there is like Australia. If I'm to help you, I need to know if your problem's in Perth or Sydney, because they are, fairly far apart. So to differentiate between vagina, which is an internal organ, and the vulva, which is all the stuff on the outside. So there are different tissues in this part of women's anatomy. So really, this is all that this slide talks about. So the vulva is both keratinized, like hair is keratinized, and non-keratinized. An epithelial just refers to the type of tissue it is. So the vulva itself is divided, that parts are keratinized and other parts are unkeratinized. The vagina, the internal organ, and it is an organ in and of itself. It's also a self-cleaning organ. So here's my little soapbox. Please, 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 if you are a woman who is douching, please stop. It really doesn't do any good for anybody. In fact, it does a whole lot of harm because it changes what we call the vaginal milieu, or the environment of the vagina. It is a self-cleaning organ. You really don't need, anything, including water, to go up there. And nobody needs down there to smell like autumn rain or spring flowers. So that's just a little bit of my soapbox, because there are so many women, despite the evidence, that are still douching. And women are not dirty down there, so you really don't need this. So vulvovaginal atrophy, so atrophy just means dryness or destruction of tissues. So vulvovaginal is really common, particularly after menopause, because lubrication, the natural lubrication in the vagina and to a certain extent on the vulva, is caused by estrogen. And estrogen affects the tiny, tiny, tiny little blood vessels in the tissues, which then secrete fluid into the tissues. So commonly after menopause, women will experience vulvovaginal dryness. And this is why it's important when I talk to women to understand where the dryness is, because if they say vaginal dryness and it's actually not in the vagina, it's vulvar dryness, the management or control of this makes a difference. Certainly significant in women who've had chemotherapy for any kind of cancer, because chemotherapy impacts on fast-growing cells, cancer, but also on the ovaries, and really essentially shuts down the ovaries, depending on age, temporarily or could be permanently as women approach the normal age of menopause. The aromatase inhibitors, which are used to prevent a recurrence of breast cancer in women who have hormone receptor breast cancer or estrogen progesterone sensitive breast cancers. The aromatase inhibitors are huge culprits of this and cause really drying, cracking, sometimes bleeding when a woman, wipes herself after urinating, and certainly after any kind of sexual touch or attempts at vaginal penetration. Vaginal dryness and vulvovaginal dryness also occurs with hormonal changes, such as in pregnancy and while breastfeeding. And women are often not told about this. And then, of course, other chronic diseases, diabetes, cardiovascular disease, multiple sclerosis, and stress. Stress impacts on our whole body. It's a mind-body thing. I just see that on the slide the arrow has moved, which is annoying. So this dryness causes dyspareunia. And I always joke that when we healthcare providers start talking Latin, it means because we're uncomfortable with the topic and we sort of hide behind it. But dyspareunia just means painful penetration. But this dryness, when it's dryness of the vulva, also causes pain with sexual touch. And what happens then, both with painful penetration and painful touch, is that the pelvic floor muscles which lie in a sling from the pubic bone in the front to the tailbone in the back, those pelvic floor muscles will tighten up in order to prevent further intrusion, particularly in the vagina. And that then causes a whole range of other pelvic floor problems, including sometimes difficulty or changes in urination, bowel problems, but certainly any attempts with penetration. With a dildo, when somebody goes to their physician and needs an internal pelvic exam, the pelvic floor tightens up. And one of my patients said to me, I went to see my GYN and she needed to examine me, and there was blood, sweat, and tears, and that was the GYN. So it really is problematic. And dyspareunia is known to be associated with distress, with sexual problems, including loss of sexual interest or desire, also called libido, and decreased relationship satisfaction. It can prevent some women who are single from establishing another relationship, because sex will often be part of a relationship, and women are just are scared that it's going to hurt. So mitigating these problems is really important. So that was your biology and anatomy and physiology lesson for the year. Let's move on to moisturizers and lubricants. So what is the difference between moisturizers and lubricants? One of the ways that I explain to my patients is moisturizers are for maintenance, M&M. So they are used just to sort of keep things comfortable. There are a multitude of products out of there. I'll talk about that in a minute. And a lot of women are using coconut oil or olive oil. I've also heard of other sort of strange oil products. My attitude to this is that if you want to apply coconut oil, organic, non-organic, I don't care, extra virgin olive oil or the cheaper stuff, it's okay on the external genitalia, but oil should not go into the vagina. And you'll hear me say this over and over and over. So, I also joke that if you want to smell like coconut muffins, use coconut oil there. But there are better products that can be used that don't stain your underwear. And I'll talk about that in a minute. The most important thing is a product that contains hyaluronic acid. People often sort of get concerned when they hear acid, but this is not something that is going to burn. Hyaluronic acid is a potent moisturizer. Any good facial moisturizer, and now body moisturizers as well, will contain hyaluronic acid. It is able to both provide and trap moisture in the skin, and in this case, in the genital area. Lubricants, on the other hand, are for lovemaking. And I tend not to talk about lovemaking because sometimes sex is not about love at all, unfortunately, but it's two L's. So lubricants are for lovemaking. And you really should not be switching them up. And I actually hear this quite often. Women will say to me, I bought a lubricant and it just doesn't work. Penetration or any kind of sexual touch is just absolutely painful. And I ask them what it is, and they tell me that they're using a moisturizer as a lubricant. So that's a no-go. So there are a whole different range of lubricants. There are water-based lubricants, which is an entry-level lubricant, commonly found in drugstores, certainly in sex stores, but you can go to any drugstore, whether it's in your local Walmart or Target, or a specific like Walgreens or CVS, and you'll find lots and lots of lubricants that are water-based. It'll say water-based generally on the label. It's your entry level. They tend to dry out quite quickly, so need to be reapplied during any sort of sexual activity that lasts longer than 3 to 5 minutes. Silicone-based lubricants are really the best lubricants to use for a number of reasons, and I'll talk about that a little bit later. And um, there are many silicone-based lubricants that you actually now get in drugstores. Even 7-8 years ago, you really had to either go online or go to a sex store to get silicone-based lubricants, but they are now quite commonly found in drugstores. Hybrid lubricants tend to contain both water-based and silicone-based. So they're a little bit cheaper than silicone-based lubricants, which are more expensive than water-based lubricants. But they have the properties of the silicone, which makes them longer lasting, super slippery, non-staining, but a little bit more expensive. I've put oil-based lubricants in brackets there because if you are using a lubricant for anything that goes into the vagina, you should not be using an oil-based lubricant for a number of reasons. The number one reason is sort of the same as why you shouldn't use an oil as a moisturizer. Oil will alter the natural pH or acid-base balance of the vagina, and it allows for overgrowth of some bacteria, overgrowth of yeast, because it impacts on that delicate balance. Also destroys condoms if you're using condoms. So generally not a great idea. Also, stain. So I've put that in brackets. And now we're seeing lots of plant-based lubricants. And sometimes they actually are made from plant oil. So once again, you have that problem of oil in the vagina. And not that easy to find. And just because they're plant-based does not necessarily mean that they're not harmful. So you've got to be careful about buying these things. Many of these products will contain preservatives and humectants, which can be very irritating. I'll talk about things that you really should avoid a little bit later as well. So how do you choose? This is a very complicated slide, and there are caveats with this. So the World Health Organization actually has a large document around lubricants and moisturizers, and they talk about the importance of osmolality and pH. I'm just going to explain that really briefly. So osmolality is if the product is going to draw moisture out of the tissues or put moisture into the tissues. You obviously don't want something that's going to pull natural moisture out of the tissues. So supposed to be really careful about osmolality, and I've got a slide coming up shortly, a very complicated slide, I apologize, that you'll see how there's sort of a real range of osmolality, and it's important. It's a little bit difficult, though, to actually find what the osmolality is of any product. I promise you it'll not be on the packaging anywhere. You essentially have to go to the product's website and dig around for it, or sometimes even call their customer service line, which makes things really difficult. The pH, as I said, was the acid-base balance, and that is important too, because the vagina is mildly acidic, and you want to keep it that way. Most lubricants will contain parabens, and parabens have been shown to be mildly estrogenic. So generally, women who have hormone-sensitive breast cancer should probably avoid products that have parabens. People are also really sensitive to that as well. And they will often contain preservatives as well, because these are fluids that come in a bottle generally, often a large bottle. So women are going to use them over time, and there's the potential for contamination. If, for example, when a woman puts a moisturizer or lubricant on her external genitalia or vulva, she will generally do that with her hand, which may or may not be super clean. I'm not suggesting that you put on gloves to do this, but just to be aware that they do contain preservatives. and people are often very, very sensitive to that. So here's the very, very, very complex slide. And, I can barely read it. I don't have my glasses with me. But you can see the range of both osmolality and pH. So if you are able to see this, and I can see it, and, this is not product placement. Generally, one of the companies that actually makes good moisturizers is a company called Yes. You may find these products in a sex store. You will probably, not probably, you'll be able to buy them online. The company has a huge number, particularly of lubricants. So, if you want to be really careful, you really do have to do a lot of digging around. And, I know that is not necessarily easy for people who, are not used to searching for information. I just call customer service and ask, I'm thinking of using product X. Can you tell me what the osmolality and pH is? So the recommendation is that the osmolality should be less than 380 milliosmoles per kilogram. And the pH needs to be slightly acidic. So, just ask, and they should be able to answer you. Thank you. And I don't know if that makes it any better. But, certainly ask your physician or nurse practitioner if they know about this or if they can help you. So here we go with hyaluronic acid, the wonder kid of moisturizers and lubricants. It can be found mostly in moisturizers, but some lubricants might have it as well. Studies have shown that it is as safe and effective as local estrogen for some women. So if you're concerned about using any kind of estrogen to help with menopausal symptoms, for example, or after treatment for cancer, and you're reluctant, and I could spend an hour talking about the misinformation about the use of local estrogen for women with dyspareunia or atrophy after cancer treatment. So here are a couple of moisturizers by name. Once again, I'm not supported by them, but these are available in the US. Lots of the most common moisturizer that most women hear about and most doctors know about and talk and recommend is a product called Replens, which is a gel. I'm not a huge fan because a lot of women tell me that it's really kind of goopy and it leaks, and they just don't like that feeling. Some of these other products, for example, Repagan is actually, it's kind of like a suppository, but it's put into the vagina, and the body heat actually melts it, and that's why it's effective. But these will also all contain other ingredients that are that can be really irritating, and so a little challenging. So how do you choose a lubricant? Well, here goes. If you could just make that bigger, it would be really helpful. So you've got your water-based lubricants. I'm actually just trying to find some readers that I can wear so that I can actually see what is on here. So water-based lubricants, fairly cheap, easy to clean up, very widely available. Do not interfere with the use of condoms or sex toys. And the problem is that they do dry out and you need to apply them quite frequently. Silicone-based lubricants, long-lasting, hypoallergenic, and a little bit more expensive. You will know that it's a silicone-based lubricant if it has one ingredient on the ingredient list, and this you will find on the packaging, and the ingredient will end with the letters CONE, so cone. So it'll be something and then cone, and then you know you've got a silicone-based lubricant. Hybrid lubes are this combination that some people really like, and we're seeing these more commonly. And then there's plant oil-based lubricants, which I do not recommend. Something that I really talk about a lot with my patients is the do not use list. Do not use anything that is warming, cooling, or intensifying. And I don't know if you remember, a couple of years ago there was a television ad there was a him and her lubricant that he put the lubricant on his penis, she put the lubricant on her, well, on or at the entrance to the vagina, and when they got together, right, when there was penetration, fireworks, orchestra playing, lots of trumpets, really not great because they are often really irritating. They burn, and that's really going to interfere with pleasure for most people. So the same thing with warming and cooling. So warming lubricants often contain chili. So and that's really what makes them warming. It's irritation. Same thing with cooling. So those are to be avoided, as well as things that are strawberry flavored, pineapple flavored. I mean, you name it. I haven't seen a cinnamon bun flavored lubricant, but anyway, those should be avoided as well because those are artificial and can be really irritating. I have heard the most astonishing things from some of my patients. Crisco, butter, petroleum jelly, hand lotion. Now, I know a lot of men use hand lotion as a moisturizer for masturbation, and that's fine because the penis is covered with skin, and skin is protective. But any kind of, mucosa like you find certainly on the head of the penis in uncircumcised men and the vulva and vagina in women, hand lotions are no-go. Petroleum jelly. I actually had a patient who told me she had severe dyspareunia. She had a history of breast cancer. Her GYN did not want her to use vaginal estrogen, which was sort of astonishing to me because just read the evidence, and suggested that she use petroleum jelly. That's a hard no from me. And I was actually just really distressed that this was a professional recommending petroleum jelly. It's super sticky. It's going to have a significant impact on the tissues of the internal tissues of the vagina. And I don't know how you get rid of that stuff because it kind of sticks like glue. Oh, and then I do have to say something about lasers, this whole vaginal rejuvenation thing. So this has actually become quite common. There are all kinds of physicians, including dermatologists, GYNs, plastic surgeons, you name it, will buy these lasers, these energy devices, and sell a very expensive treatment to women to rejuvenate the vagina. And I'm not, I'm not even discussing some of the surgery that is recommended for women to, to tighten the vagina. These are these energy-based lasers that they claim, increase moisture and lubrication, tighten. I mean, it's just absolutely crazy. And study after study have shown that these lasers are essentially useless. Come with actually an FDA warning that they can cause severe burns. And, I don't know, I just crossed my legs when I thought of vaginal burning, frankly. It's a huge moneymaker. Generally, these these interventions cost $2,000 for each treatment. It's generally recommended that women have 3 or 4 treatments with, spaces in between. So very, very expensive, uh, do not help, and actually cause harm. So that is my half hour. I think I was told 25 minutes, but here we go. So questions, comments.
All right, I unmuted myself because awesome job. Such good information. Absolutely love your do not use list. Very helpful and valuable. And then two, I think it's so important. There's a normal flora that are there in the vaginal area and the vulva as well. And we don't want to mess with that. And I think so often what we find is people are really disturbing that normal protective flora that are there in that area, and it can really be challenging. So I think you did a great job talking about the self-cleaning thing, because so often people are so self-conscious about their genitalia, the vaginal area, right?
Yeah.
It's really it's challenging. And I don't know about you, but often sometimes too, I just will often ask the patient, I'll say, have you ever really looked down there? Have you looked down there and, and checked everything out? And oftentimes they're like, no, I haven't really. So, I think it can be really helpful with your provider. They can take a mirror, they can take to show you exactly and help you see, or you can do it on your own and see that kind of thing. I'll never forget. I'll never forget that great scene during Fried Green Tomatoes, where all the women were in a circle and they're like, "And now we're going to view our vagina."
Correct.
But I do think it's important to know your anatomy and understand your anatomy. So much good information, and we do have a couple questions that have come across. So let me give you those. The first one,
One thing I forgot to
yes.
add. If you're using a silicone lubricant, you cannot use a silicone lubricant with a dildo or vibrator that has a silicone covering.
Mm.
I do not understand, like, sort of the mechanics of this, because I'm just a nurse. Um, but apparently the silicone lubricant will degrade the silicone covering of whatever the sex toy is. So
Mm.
that's just something that's important to remember, because a decent toy is going to be expensive, and you really don't want to degrade it, because then you just have to buy another one.
Definitely true. Definitely true. So this question came from Stephanie Fletcher. She said, Dr. Katz, for women in menopause and may have had a complete hysterectomy, is there a way that pH can be balanced?
Yeah, just leave it alone. So, don't go there. It'll, the body is miraculous. I'm
Mm,
constantly, even though I've been doing this for 20 years and I've been a nurse for 15 years, more than that, the body is absolutely amazing.
mm,
So the vagina is self-cleaning. Do
mm,
not, touch it. Go ahead,
mhm,
when you explore, but just don't use anything to clean. And in fact, women do not need to use and should not use soap or any kind of soap products, body washes, etc. The Vagisil, for feminine hygiene. There's something else now that they've come out with, um, to clean the vulva and vagina. You
mhm,
don't need to use that. You can it's fine to just use water. This sort of goes back into that whole shame thing that particularly
mm.
women have about their genitalia. Most men have huge pride in their genitalia.
It's
But
true.
women know, we've been taught to feel ashamed of our
Yes.
bodies on so many levels, and often it's to sell products. So
Mm,
just leave it alone, right? It'll clean itself. If you do feel that you need to use something because, you've been persuaded, often by your mom or grandmother or another female relative, if you do really want to use soap, you can use it on the mons, or the area that sort of faces frontwards, that generally has hair on it, even though it's now in vogue to get rid of all of that hair, which is not good because it serves a purpose. But you can certainly do that, but just avoid the vulva. Absolutely avoid the vagina. If you really do want to use something, there are some products, and I'm going to name it because I think it's important that people know this. Cetaphil makes a gentle facial cleanser. You can get it in like a bottle about this big. It's got a pump on the top, and that does not contain soap. So I personally use it when I wash my hands before I put my contact lenses in, before I take them out, because if you wear contact lenses and you have any soap residue on your hands, you know how painful it is when you put them in or take them out. So the Cetaphil gentle facial cleanser does not contain soap. It's not perfumed. It's a really nice product if you really do want to use something, just because it makes you feel better. I mean, it's not really going to do much, but if it makes you feel better, then that's a good product to use.
I tell my patients often too, like when they're trying a lubricant or something of that sort, that they might try it on your arm, because your arm, if you get a rash or have an allergic reaction, it's much more forgiving on your arm than it is to try it on the vulva area. So I always tell them, try it there first and then go to the vulva. Yes, you got that right, Stephanie. Cetaphil, you're correct. That's it. And then this question came across on my email. They said, this person said, I have always been self-conscious about the fact that I seem to have a rush of fluid during climax. Do women ejaculate with orgasm?
Yeah, some do. It's called squirting, and it's apparently, I've not seen these myself, it's apparently extremely popular on the internet. And there are actually some women who feel bad because they don't. So it's commonly called squirting. And okay, hang on. I actually lied. I have seen examples of this from a purely educational rationale, and there's can be a huge amount of fluid. It is there's been sort of debate for many years about whether this is urine or not, and the studies that they've actually looked at the stuff is that it's not urine. Now, some women will urinate during sex because the vagina and the urethra, the tube that carries urine from the bladder to the outside, they share a wall. So they're very, very close together. So sometimes the friction can cause some urine to leak, but that generally does not tend to be sort of a rush of fluid. The other thing is that women who have a lax pelvic floor, so this is the opposite of the tight pelvic floor that is protective when a woman experiences pain with penetration or touch. But some women have a lax pelvic floor, particularly women who are quite significantly overweight, women who've had multiple pregnancies, women who've had big babies, women who, unfortunately, during labor were encouraged to push by a enthusiastic nurse or doctor because they want to take a break. So they want the woman to push, and the woman can push for 3, 4, 5 hours. I think that's absolutely criminal. And that can actually damage the pelvic floor. And certainly actually after menopause, women tend some women will have incontinence or bladder leakage because of the lack of estrogen. So the estrogen contributes to collagen formation, and collagen is what forms a matrix in our tissues. And many women will recognize this. As we get older, we get wrinkles, often from sun damage, but predominantly because of the loss of estrogen, loss of collagen, and we get wrinkles. And then the same sort of stuff is happening in the pelvic area, in that the organs, the bladder predominantly, the uterus to a slightly lesser extent, already held up by the pelvic architecture, we call it. And with loss of collagen, with aging, urinary tract infections are more common. Um, so, here's a little pearl. If you are a woman who is experiencing urinary tract infections, certainly around the time sort of later perimenopause and certainly after menopause. So often postmenopausal women will have repeated urinary tract infections, and they're put on antibiotic after antibiotic after antibiotic, will often be prescribed, antibiotics for long term, which has all kinds of impacts on the gut and everything else. There is now really good evidence that vaginal estrogen actually prevents urinary tract infections in postmenopausal women. And I've seen reports of, women in their 80s who have been on antibiotics for 5 years. Someone smart who's been reading the literature prescribes vaginal estrogen, and they never have another urinary tract infection. So that's a little pull for you if you're affected by that. Speak to your primary care provider or your GYN about using some local estrogen. It's an absolute life changer.
Definitely, and can help as well with moisturization
Yeah,
of the vagina
absolutely.
and with urinary leakage and things. So it is really important, and I've seen
Yeah,
it change lives too.
yeah,
So I guess the real message is to everybody out there: don't worry about and don't be self-conscious about your miraculous, amazing body. If you ejaculate, women do ejaculate sometimes. It is documented in the literature. Women do. If you don't, it's okay too. So everybody's different. We're all different and unique, but it's pretty miraculous and amazing, as you
yeah.
said earlier. Our bodies are. One more.
Just
No, go ahead.
practically. I mean, if that happens to you, put a towel under you.
Mm-hmm.
It's not. It's normal. It's natural, and
Mm-hmm.
people are making money from that, taking videos and stuff. Not a suggestion, just a comment.
Definitely. And men ejaculate. It's not a big deal if either way, if someone ejaculates or doesn't ejaculate, it's all good. So, this question was another question that had come across. Uh, and that was, do you have some suggestions on how do I incorporate the use of the lubricant into sex with my partner?
Yeah, really important question. And, this gets to the logistics. First of all, have the lubricant close at hand. You don't want to, in the heat of the moment, have to get up and go rummaging in your ensuite bathroom. So have it close by. And, you decide with your partner who's actually going to apply it. So for a lot of heterosexual couples, the man will put a couple of drops on the head of the penis. Um, just got to be careful because the stuff can go all over the place, right? So generally, just a couple of drops are all that is needed, and then with penetration, the lube will sort of spread. Or women can apply it themselves. So all you need to do is, first of all, it's also really important to use a lubricant for sexual touch if you've got dry vulvar tissues, right? Because any kind of clitoral stimulation is going to cause friction and is painful, and then you get that whole pelvic floor thing. So a woman can put a couple of drops on one or two fingers and just sort of smear it over the vulva with a little bit extra just at the entrance to the vagina. And with penetration or with using a dildo or a vibrator, the lubricant will spread. So you don't need to think about like applicators and stuff for lubricants in the vagina. It'll just naturally go up there.
Definitely. Well, this has just been so informative and so excellent. I thank you so much for all this great information. And I know people have learned a lot. And I hope you will come back and join us for more because there's so many topics that I know you could talk more about. So thank you, thank you, thank you so much, Dr. Katz. I would like to take a moment to have everybody pause for just a moment, and we'll talk next about what's up next week. But okay, we talked about a lot of things. We got into some anatomy and physiology with vulvas and vaginas and osmolality and pH and all kinds of things. But take a moment to pause and to get yourself in a comfortable position, please. If you're able, close your eyes and take a deep breath in for about 4 counts. and slowly exhale for about 4 counts. Continue that breathing pattern. Fill your diaphragm, fill your lungs, 4 counts in, and slowly exhale. Let your shoulders relax. Let your jaw unclench. Feel your body settle into this moment. Now, place your hand over your heart. You feel the warmth of your touch, the steady rhythm of your heartbeat. This is your center. This is where love and kindness begin. Silently or aloud, repeat these affirmations. May I be kind to myself. May I be healthy, safe, and at peace. May I allow love to flow freely through me, just as my soul was designed to do. May those I care about be happy. May they be loved. May they feel supported and whole. Take another breath in and exhale slowly. Feel the connection between yourself and the world around you. Carry this love and kindness with you as you move through your day. When you're ready, gently open your eyes. Well, it's been a great program and a great episode. Vic, can you show us what's coming up next week?
In this enlightening episode, Dr. Jeff welcomes pelvic floor physical therapist Dee Hartman to explore the vital role of the pelvic floor. Pelvic floor affects sexual health, urologic function, and overall well-being. The presentation will include a discussion on how maintaining pelvic floor health can improve intimacy. We will address common health concerns and discuss enhancing quality of life for both men and women. Tune in for expert insights and practical advice on caring for this often overlooked yet essential part of the body.
Wow, we talked a little bit about the pelvic floor, and next week we're going to talk a whole lot about it.
Excellent.
Thank you so much for joining me this evening. It's been great, and I so appreciate you sharing your expertise on lubricants and moisturizers.
My pleasure.
Everybody, have a great evening.